Nipah virus, everything you need to know. Nipah virus, NIPAH, is a zoonotic, human-to-human, virus that can be spread through contaminated food or directly between individuals. The virus can also cause severe illness in animals like pigs, causing farmers to lose a lot of money. Although there have been a few outbreaks in Asia, the Nipah virus infects a wide range of animals and causes severe sickness and death in humans, making it a public health concern. Past outbreaks. The Nipah virus was initially identified in 1999 during a pig farmer outbreak in Malaysia. Evidence of the virus has been detected in the recognized natural reservoir, Pteropus bat species, as well as numerous other bat species in a number of countries, including Cambodia, Ghana, Indonesia, Madagascar, and the United States. Transmission. The majority of human infections during the first known outbreak in Malaysia, which also afflicted Singapore, were caused by direct contact with sick pigs or their contaminated tissues. Consumption of fruits or fruit products, such as raw date palm juice, contaminated with urine or saliva from infected fruit bats, was the most likely cause of infection in following outbreaks in Bangladesh and India. Human-to-human transmission of the Nipah virus has also been recorded among infected patients' family members and caregivers. Nipah virus transferred directly from person to human during subsequent epidemics in Bangladesh and India due to close contact with secretions and excretions. Between 2001 and 2008, human-to-human transmission through giving care to infected patients accounted for over half of all reported cases in Bangladesh. Sign and symptoms. Asymptomatic infections to acute respiratory infections, mild to severe, and deadly encephalitis are all possible in humans. Fever, headaches, myalgia, muscle pain, vomiting, and sore throat are some of the early symptoms experienced by infected patients. In extreme cases, encephalitis and strokes occur, progressing to coma within 24 to 48 hours. The incubation period, the time between infection and start of symptoms, is thought to be between 4 and 14 days. However, it has been reported that the incubation period might last up to 45 days. Although most persons who survive acute encephalitis recover completely, survivors have been found to have long-term neurologic problems. Diagnosis. The signs and symptoms of Nipah virus infection are ambiguous at first, and the diagnosis is frequently overlooked at the time of presentation. During the acute and convalescent phases of the disease, clinical history can be used to diagnose Nipah virus infection. Real-time polymerase chain reaction (RT-PCR) from bodily fluids and antibody detection via enzyme-linked immunosorbent assay are the most common techniques utilized. ELISA. The polymerase chain reaction (PCR) assay and virus isolation by cell culture are two more procedures that are employed. Treatment. Although the WHO has recognized Nipah virus infection as a priority disease for the WHO Research and Development Blueprint, there are presently no medicines or vaccines specifically for Nipah virus infection. Nipah virus is naturally found in fruit bats of the Pteropodidae family, particularly those of the Pteropus genus. Antibodies against Nipah and Hendra viruses were identified in African fruit bats of the species Eidolon, family Pteropodidae, indicating that these viruses may be present within the geographic distribution of Pteropodidae bats. Nipah virus in domestic animals. During the initial Malaysian outbreak in 1999, outbreaks of the Nipah virus were first detected in pigs and other domestic animals such as horses, goats, sheep, cats, and dogs. Some infected pigs experience acute feverish sickness, hard breathing, and neurological signs such as trembling, twitching, and muscular spasms, while others show no symptoms. If pigs also have a strange barking cough or if human instances of encephalitis are present, Nipah virus should be suspected. Prevention: vaccines against the Nipah virus are currently unavailable. Because Nipah virus outbreaks have implicated pigs and/or fruit bats, developing an animal health/wildlife surveillance system to detect Nipah cases utilizing a One Health approach is critical in providing early warning for veterinary and human public health. Reducing the risk of infection in people. In the absence of a vaccine, the only way to reduce or prevent infection in people is by raising awareness of the risk factors and educating people about the measures they can take to reduce exposure to the Nipah virus. Controlling infection in healthcare workers. Healthcare personnel who care for patients with a suspected or proven infection, or who handle specimens from them, should always follow conventional infection control protocols. Because human-to-human transmission has been recorded, contact and droplet precautions should be implemented in addition to conventional measures, particularly in healthcare settings. Samples taken from people and animals suspected of being infected with the Nipah virus should be handled by competent personnel in properly equipped laboratories. WHO response. WHO is providing technical assistance to affected and at-risk nations on how to manage Nipah virus outbreaks and prevent them from occurring. Fruits or fruit products, such as raw date palm juice, contaminated with urine or saliva from sick fruit bats can be washed thoroughly and peeled before consumption to reduce the danger of international transmission. Fruit that has been bitten by bats should be discarded. Fruit that has been bitten by bats should be discarded. Thanks for watching. Please like, share and subscribe.